Hello friends, this YouTube channel is all about how can you conceive naturally. If you are interested, please subscribe this channel. Hello friends, today I am going to tell you how can you conceive naturally. The method I am going to tell you is based on research of Dr. Jonas. As per Dr. Jonas, this method is having a success rate of 98%. Benefits of Dr. Jonas method. So everybody will ask, what are the benefits of this method? I would like to say that Dr. Jonas method is completely natural, and everyone who is trying for expensive methods like intrauterine insemination, IUI, in vitro fertilization, IVF, intracytoplasmic sperm injection, ICSI. I also want to mention that this method may take 3 to 6 months to work, so be patient. Before discussing the whole lengthy method, it is better to discuss when this method will not work, so that we can save time of our viewers. Even it may not work, there is no problem in trying this method because it is completely natural and just requires some mathematical calculation. This method does not works in 2 cases. Women is having blocked fallopian tubes. If the male partner is having low sperm count, the good news is that sperm count can be increased by use of some natural or Ayurvedic medicines. Please check our video how to increase sperm count. Dr. Jonas method. As per Dr. Jonas, the most fertile time of any person will be during the same phase of the moon as that in which the woman was born. For instance, if the woman was born at the time of the full moon, when the moon makes an angle of 180 degrees with the sun, the time of fertility during her adulthood will be whenever the moon is full, and this independently of her menstrual cycle. Step-by-step procedure. Point 1. Clean your body. Point 2. Start to have intercourse at most fertile time. Point 3. Change food. Point 4. Change lifestyle. Point 5. Points to remember. Point 6. Remove stress. Point 7. Miscellaneous. Point 8. Useful books. Smoking. You are required to quit smoking. Also remember, passive smoking is equally harmful. Smoking impacts the fertility in males and females. It also impacts the baby. It will take about 3 months after you quit smoking to recover body alcohol. Both partners are required to quit smoking. Alcohol causes fertility problems in women. Excessive alcohol causes lower sperm count in males. It also impacts the baby. Caffeine. Both partners are required to quit caffeine. Caffeine is even required to avoid after conception by mother. Steroid hormone. Some medicines contains it, especially contraception drugs. Fish is required to be avoided because of high mercury contents. Some seafoods which do not contains mercury can be taken. Mercury sticks around in the body. Women should avoid fish with high levels of mercury for a year before they get pregnant, not just during pregnancy. Tobacco. Both partners are required to quit tobacco. Start to have intercourse at most fertile time. As per Dr. Jonas method, we need to have intercourse at most fertile time. For calculating this time, we need a calculator. One of the best and free calculator is available at below website. Change food. Aim to eat 70 to 80% alkaline foods. Take as much natural food as possible. Do not use plastic wrap or place plastic wrap over food in the microwave. Avoid processed foods and soy products. Change lifestyle. No hot tubs. Avoid hot tubs before sex because the high temperature can quickly kill off sperm. Have intercourse once in 2 days. Too frequent intercourse will degrade sperm quality, and too less intercourse will cause less mobile sperms. Avoid use of recreational drugs like marijuana, cocaine while trying to conceive. Avoid vaginal lubricants. Most vaginal lubricants are sperm killers. Points to remember. Try to achieve a normal weight before attempting for baby. Obesity and lower fat can make you ovulate irregularly or not at all. Body fat distribution in women of reproductive age seems to have more impact on fertility than age and obesity. There must be intimacy between couples for better working of hormones. Check doctor for thyroid if suspect. Thyroid may cause infertility. Low sperm may be caused by zinc deficiency. Also possible with deficiency of vitamin A, B and selenium. Anovulation caused by underweight can be treated by healthy food habits. Missionary position is best. Also lay down in same position for half an hour in which you have intercourse. It will give more time for sperm to reach cervix. If low sperm count or cervical fluid is low quality, maintain body fat percent to at least 20%. Remove stress. Stress can prevent pregnancy. Especially in India, women without baby for long time started to get stress because of cultural impact. Continual stress tend to normalize over time and body starts functioning normally. Do you remember the things you were worrying about a year ago? How did they work out? Didn't you waste a lot of fruitless energy on account of most of them? Didn't most of them turn out all right after all? Miscellaneous. Check cycle length. Person with long cycle may be trying on wrong day because of general 14th day rule. Specially check for old age person because they may be having less frequent intercourse. Chart your cycle. Steer clear of fatty meats, dairy, cheese, sweets, chocolates, alcohol, and tobacco. Packaged foods are often full of hidden offenders and microwave meals are full of sugars and salts. Overcooking also removes all of the nutrition from a meal. Useful books. Below are the links of useful books. Archive.org is a good website if you want to read book for free. I have provided links of free books also. The Lunar Cycle, Astrological Fertility Control by Nayish Francesca. Infertility, a Women Doctor's Guide by Susan Treiser. The Infertility Diet, Get Pregnant and Prevent Miscarriage by Fern Rice. Taking Charge of Your Fertility, The Definitive Guide to Natural Birth Control, Pregnancy Achievement and Reproductive Health by Weskler, Tony.